अस्सलामुअलैकुम। अब चलते हैं नेक्स्ट लेक्चर की तरफ और इस लेक्चर को प्रेजेंट करेंगे हमारे काफी इमरान बॉस जो डिपार्टमेंट ऑफ पैथोलॉजी से हैं और उनका टॉपिक प्रेजेंटेशन है यूनानी डायग्नोस्टिक अप्रोच टू किडनी डिजीज। तो मैं दावत देना चाहता हूं डॉक्टर इमरान बॉस को कि डायस पे आके अपनी सिरोसिस के सिरोसिस का जो टॉपिक है उसको हम सभी के लिए शेयर करेंगे। डॉक्टर इमरान बॉस, बहुत बहुत शुक्रिया। आप सभी न्यू फ्रेश पीजी स्कॉलर्स का तहे दिल से इस्तकबाल करते हैं और दुआ करते हैं कि आप लोग आगे और तरक्की करें, हमेशा कामयाब रहें। आज का मेरा प्रेजेंटेशन है यूनानी डायग्नोस्टिक अप्रोच टू एमआरआई लिया लिटरेचर रिव्यू। ये टाइटल है, टाइटल ऑफ स्टडी जो सिलेबस के लिए तैयार किया गया है, यूनानी डायग्नोस्टिक अप्रोच टू एमआरआई किडनी डिजीज लिटरेचर रिव्यू। हमारे गाइड हैं डॉक्टर अहमद, डिपार्टमेंट ऑफ मानसुल इमरान, असिस्टेंट प्रोफेसर है। दूसरे हैं वो गाइड डॉक्टर मोहम्मद शहीद अख्तर, असिस्टेंट प्रोफेसर, डिपार्टमेंट ऑफ मानसुल इमरान। और हमारे एचओडी हैं प्रोफेसर डॉक्टर तोहर। सबसे पहले किडनी डिजीजेस एंड इट्स प्रेवलेंस। In India, there are approximately 7.85 million people suffering from kidney disease. As per global burden of diseases study in 2015, about 1.2 million people died from kidney failure, and thus kidney disease was the 12th most cause of death, which is an increase of 32% since 2005. Now, worldwide, 850 million people are estimated to have kidney diseases from various causes, and chronic kidney diseases causes at least 2.4 million deaths worldwide per year, and is now the sixth fastest growing cause of death. The most common risk factor for chronic kidney diseases include diabetes, hypertension, cardiovascular disease, a family history, and age greater than 60 years. In India, prevalence of proteinuria was 2.25% in the study populations. The incidence of acute kidney injury in India varies from 0.8 to 38%. The observed incidence of AKI was 8 per thousand admissions. About 92.2% had acquired AKI and 7.8% were hospital acquired AKI. Kidney stones are commonly worldwide with a prevalence of about 12%. In India, the prevalence of kidney stone is also approximately 12%. Need of study. Well-functioning kidneys are essential to our overall health. At present, the burden of kidney diseases is growing rapidly due to the present lifestyle, food and drink habits, use of medicines, and diseases like diabetes and hypertension. The most common type of kidney disease is chronic kidney disease. Other diseases include acute kidney injury, kidney stone, kidney infections, kidney cysts, and kidney cancers. To control the rapidly growing burden of kidney diseases, social awareness and early identification of kidney diseases is essential because most diseases are asymptomatic in the earliest stage and later lead to serious health problems. In the United States of medicine, various literature is available related to diagnosis of kidney diseases and their treatment. Diagnosis of kidney disease by examination of urine and pulse was done from ancient United physicians like Hippocrates, Galenos, etc. to the period of Hakim Ajmal Khan and also now in practice by United physicians. Our ancient United physicians listed the important signs and symptoms for identification of common kidney diseases and their diagnosis through examination of urine and pulse, along with other diagnostic parameters in their respective literature. If the Sina mentioned the 9 type of kidney disease in our Kanun, Ismail Giuliani in Zafira Farid Shahi described the 14 types of kidney disease. Aksir Azam and Al-Aksir by Azam Khan give the details about 12 types of kidney disease and so on. Some types of some kidney disease has been also described. Thus, we found that details about kidney disease are in a scattered manner. Our study is to collect and compile all Unani diagnostic parameters for identification of kidney diseases available in different Unani literatures. लिटरेचर रिव्यू थोड़ा लंबा है लेकिन बैकग्राउंड ऑथोरिटी काम से दिख रहा है क्या आप लोग को जी दिखने में थोड़ी प्रॉब्लम तो हो रही है In the United States of Medicine, collections of signs and symptoms of all diseases are available in literature, which are still in practice by physicians today to identify the disease. United physicians also developed some diagnostic tools to diagnose the disease. Examination of nerves, bone, bars, and their interpretation have an important role in diagnosis of disease. Bukrat is credited with being the original endoscopist. Ibn Sina described endoscopy in scientific manner. He pointed out the following observation in the urine sample. Alwane bol, Kawame bol, Sapphire Kadurat, bol, Rasul bol, Dikdar bol, Bue bol, और जब दल को सबका इंग्लिश टर्मिनोलॉजी दिया है Ancient United physicians classified kidney diseases into 4 major categories: Amrad Aslu-Mijaz, Amrad Aslu-Tarkib, Amrad Aslu-Tafuruk-Sal, Amrad Aslu-Sutta. Disease of morbid temperament, structural disease, disease of cause of mortality, and disease of obstruction. Common kidney diseases described by Unani physician literature are as follows: Aslu-Mijaz Kulliya, morbid temperament of kidney; Hazal Kulliya, renal atrophy; Zuf Kulliya, renal debility; Renal Kulliya, flatulence of the kidney; Wajal Kulliya, renal pain; Sulta Kulliya, obstruction in kidney; Worm Kulliya, nephritis or inflammation of kidney; Zubaila Kulliya, renal abscess; Kurvan Kulliya, renal ulcer; Zabul Kulliya, renal irritability; diabetes, and Hasat or Kulliya, renal calculus. Literature review continue. Diagnostic parameters of kidney diseases include, according to United physicians, as available in literatures, first quantity, time, and order of urine color of urine and mixed substances coming out with urine, sexual behavior, respiration, feeling of thirst, condition and nature of back pain, condition of bilateral lower limb, nature and side of pain, through lymphedema, palpation of kidney, and those things which is beneficial and harmful for kidney. Next example, if a person has odor and color of urine, passes small smell urine, red or yellow in color. Other immune characteristics include having urgency or inflammation and burning sensation, thirst feeling of thirst ज़्यादा है, sexual behavior increased libido है, pulse नब्ज सही है, then it is considered that the person is suffering from Aslu-Mijaz Kulliya. Now again, if a person has following features, this is the color of urine, white urine, thirst feeling, no feeling of thirst, sexual behavior, loss of libido, Lamsepurta, feeding of food on renal angle. Other characteristics include lumbar region, bed-like work person, face color become white, generalized weakness, history of cold exposure. The patient will be of Suevida Baris Punja, Balgami. The literature will continue. Bogrant stated that if the OID unit comes easily, indicates heat is dominant on kidney. When heaviness and pain present on the renal angle along with the sign and symptom of Suevida and dominance of Tiltatum, then it is Suevida Harpulia. If burning and pricking sensation on the body with the evidence of increased increased temperature, etc., the person using of fluid are clear. Sapral. Ibn stated that Dupseculia is a disease in which kidney functions either gets decreased or collapse, in which separation of water and other substances from blood gets disrupted. Razi stated that Dupseculia is a pathological condition in which kidneys are unable to separate water and other substances from the blood and pass it out as such into the urinary bladder, resulting in excretion of protein containing urine. Its common signs and symptoms include frequent and low urine output, sexual debility, weakness of vision, and headache. Under uroscopy, the type of urine found is ball and massage, like water of fresh washed meat. Kunti stated that if the kidney becomes weak and its fats get lost, then vision will be weak and headache occurs, less helpful, and patient not able to hold urine. If a patient is suffering from dysphoria with bolarius, generalized weakness, loss of libido, mild lumbar pain, mild headache, especially on occipital region, with a history of fluid withdrawals, excess sexual act, and excess estradiol, withdrawal, ishal, and evacuation, diuresis, or purgation, or any of three conditions, it indicates the kidney disease named as Hazare-Kullia. In renal kullia, pain found on lumbar region and renal angle, tenderness without heaviness, no evidence of renal stone, mild scattered abdominal pain, pain and tenderness reduced in the empty stomach and after complete digestion. The sign and symptom of kullia are nausea and pain without heaviness or renal angle, with hematuria, bad smell in urine, feeling of thirst, under the uroscopy, Rasud Farati Sur, reddish flaky scale in both is a diagnostic feature of kullia. While in Pure Masana, vesicular Rasud Farati areas and Pure Majari में रसूबे बीती है ना purulent sediments found in gold. Kersey stated that at the initiation of fever with brain, viscera, and liver upset, and with no diarrhea, diluted urine with white color is indication of vermiculita. Now, again, according to shape, if whiteness of urine becomes continued, it indicates that either hardness will be developed in one or converted into abscess. Vermicullia heart. Heart inflammation of kidney. Irregular fever, pain and heaviness on affected side, excessive thirst, difficulty with situation, mental confusion, initially urine color is waxy, then orange, yellow, and like fire, and the it becomes reddish. If fever without burning sensation, heaviness with redness on back, feeling no more thirst, fever like Huma Masvika, also dominant feature of piltatum, then considered as vermicullia heart therapy, heart sanguineous inflammation of kidney. Now, if high grade fever with burning sensation and headache, excessive thirst, bilious vomiting, sleeplessness, low urine output, and frequent nerve swelling and matawatir, along with dominant feature of safra, it is considered that patient is suffering from vermicullia heart safra. In one peculiar barring cold inflammation of kidney, mild pain, heaviness, accompanied with tension, perforation of face, and generalized fluidity of the body, whiteness in both brows, nerves fatigue, found along with dominant feature of bulb. Vermiculia sulab, heart inflammation of kidney, is dangerous condition of kidney characterized by more heaviness with mild pain or lumbar region, low urine output, and frequent with rapid kapudi, color, back, bent forward, dampness of the lower part of the body, watery urine, and it may lead to ascites, dominant feature of sauna. According to Ali Ibn Abbas Majusi, renal calculi are one due to increased Harate Parencia and Magda. Of these calculi derived from viscous and mucous matter. These matters may be fragmented or viscous or blood. According to diagnosis, ulceration in the kidney is the main cause of kidney stone. Razi mentioned the symptoms of calculi, that is renal pain, incontinence of urine, and person passing standing precipitate in their urine must have calculi in the kidney. If we see and describe the characteristics of pulse in relation with the interplay of four humors, dump, balgam, sabra, sauna. He described various pulse modes and classified the pulses on the basis of distinct characteristics. Nerves of Zophipulia is found weak, nerves of Pluripulia is steady, sulab, voluntary. Objective of the study to collect and compile the descriptions of all Numbasiculia with their diagnostic parameters, including count, signs, and symptoms, and other approaches available in different literatures. To propose potential application of these dynamic diagnostic approach in wellness, prevention, diagnosis, treatment, and forecast advisory of kidney disease. To provide precise research literature for more in-depth studies in future. Source of data. The literary material will be collected from the following sources: or classes book of Iranian medicine and their translation of literary. Previous thesis and dissertations, reputed online offline medical journal, other books related to microscopic from reputed authors publishers, website related to international health organization like WHO, UNICEF, CDC, website related to national health program organization like CCRUM, IU, CCIM, NCIS, CSIR, authentic online search engine, Google Explorer, PubMed, ResearchGate, PubMed Central, Direct Science Direct, IBS, and Wholesale Studies Library. Major collection of existing material of all for kidney disease will be collected after that. Collected material will be systematized in such a manner that all pathological and diagnostic approach of each kidney diseases are held separately. The exploratory notes will be added as an observation results, and on the basis of literature review and observation, the discussion and conclusion will be made. Place the visit for the search of classical unit tests and research papers on set topics following. Library place may be visited or communicated to get access to the material. Coverage Central Library, GTCH Patna, Padabab Khan Library Patna, Library of Indian Research Institute, University Patna, Central Library in IU Bangalore, Jamia Ahmad, Central Library New Delhi, Maulana Library AMU Aligarh, Ibn Sina Academy Aligarh, and reputed neurologists. Time and duration, 12 to 18 months. Select subsidiary Department of Medical Affairs, Government JP College Hospital, Patna. Does the study require any investigation or intervention to conduct it on patient or human or youngly animal? Answer is no. Has ethical clearance been obtained from the institutions applied for it? Has the departmental search committee approval obtained applied for? It's a reference. Thank you. Personal lumbar बहुत बहुत शुक्रिया इमरान बॉस, आपका लेक्चर काफी अच्छा था। तो फिर मिलते हैं सेकंड